Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. I'm pleased to be back to provide another daily update and talk about the next phase of COVID-19 in our province. First, here are today's numbers. In the last 24 hours, we identified 194 new cases and completed about 7,100 tests. Our positivity rate was about 2.9%. Currently, 84 people are being treated for COVID-19 in hospital, including 18 admitted to the ICU. Cases have risen recently, almost entirely in those who have not been fully vaccinated, as we expected would likely happen as people come in close contact with each other again. Similar trends are being seen in other provinces that have lifted restrictions. I am pleased that overall hospitalizations continue to decline, and we will keep watching these closely. As I've said before, vaccines dramatically reduce the risk of severe outcomes and the risk of infection. For example, since July 1st, people who were not fully immunized made up 95% of all cases of COVID-19, 94% of all those who have needed hospital care for COVID-19, and 95% of all COVID deaths. Having 2 doses of vaccine has never been more important. The Delta variant spreads more easily, and that second dose is critical for protection. That's why it's good news that more than 64% of eligible Albertans are now fully immunized, and 75% have had at least 1 dose of vaccine. We still need to increase those numbers, but this is encouraging progress. With so many people protected by vaccines and doses available right now for anyone 12 and over, the threat of this still dangerous virus is shifting. While COVID-19 cases may rise in the coming weeks and months, a surge of hospitalizations and other severe outcomes is much less likely thanks to vaccines. I know that the rise in cases over the last week has created some anxiety in some people. After all, we have been closely watching case counts for well over a year. When we heard of COVID-19, first, we knew little of the virus and we had no treatments and no vaccines. This meant we needed to enact unprecedented measures to protect human life and to prevent our healthcare systems from being overwhelmed. We have made incredible sacrifices, staying away from loved ones, closing the doors of our businesses, and canceling important events, all to protect one another. These sacrifices were necessary at that time. Today, we are in a very different place. Vaccines are able to drastically reduce the risk of not only contracting the virus, but more importantly, getting severely ill. From a public health standpoint, this has changed how we need to look at the virus. As we have always done, we need to weigh the direct impacts of COVID-19 against the indirect impacts that come from our interventions, especially on children and other vulnerable groups. With a vaccine readily available, the need for the types of extraordinary restrictions we used in the past has diminished. At the same time, we must also start preparing for other health challenges. Last year, we saw an extraordinary decline in other respiratory viruses. In fact, there was not a single case of seasonal influenza identified. We expect that to change soon. With the unprecedented public health measures used over the last year no longer in place, we will likely see higher levels of other respiratory viruses like influenza starting late this summer and into the fall. Vaccines for some viruses like influenza are available, but this will mean more patients needing testing for clinical reasons and in some cases medical care. We need to make sure that Alberta's health system is able to support all patients. That is why we are making changes to bring COVID-19 measures in line with how we handle other respiratory viruses, while keeping strong measures in place to protect Albertans. After the past 17 months of restrictions, I know this will likely feel like a dramatic shift for many. We have grown accustomed to protective measures, so some anxiety is only natural. I want to assure Albertans that some things will not change, not tomorrow and not any time this year. We will continue to respond to COVID-19 in keeping key measures in place to protect everyone, including having vaccine appointments widely available, testing symptomatic Albertans for whom this information will change their treatment, and preventing and managing outbreaks in high-risk locations like continuing care. However, we will start to change several other things gradually while keeping a close eye on hospitalizations in Alberta. The first changes will happen tomorrow and are relatively small. As of tomorrow, quarantine will no longer be universally legally required for close contacts of confirmed cases, although it could still be required in some high-risk settings or for outbreak management. We are still recommending that close contacts who are not fully immunized avoid public places for 14 days, and we still have mandatory isolation for both positive cases and symptomatic people. Anyone who knows they have been exposed to COVID-19 should monitor for symptoms and should seek testing if they become symptomatic. We will be stopping routine asymptomatic testing for close contacts. This will help reduce wait times and ensure timely results in the coming months. But to be clear, anyone experiencing symptoms should still isolate from others and will be able to get tested province-wide. As quarantine is no longer required, contact tracers will no longer call close contacts. We recommend that where it is possible to do so, positive cases can notify their close contacts. Public health will start focusing on identifying and managing outbreaks only in high-risk locations, such as continuing and acute care and high-risk workplaces. We will keep watching COVID-19 closely and will take whatever actions are needed to manage any high-risk outbreaks or severe cases, as we do with any communicable disease. Over the next 2 weeks, we will closely monitor these changes and adapt as needed to give more time to vaccinate Albertans before the remaining changes begin on August 16th. These upcoming changes in mid-August will be more significant. For example, provincial masking orders on transit, taxis, and ride-shares will be lifted on that day. Of course, masks may still be required in specific settings like vaccination sites, hospitals, and continuing care facilities. At this time, we are not planning to require universal masking in schools. However, we will be recommending it as a temporary outbreak intervention in response to respiratory outbreaks. Schools will also be asked to support those who choose to wear masks. We know that many parents and teachers have questions, and a guidance document is being finalized and will be released in mid-August to support return to school. In addition, starting August 16th, isolation will no longer be universally legally required if you test positive for COVID-19, although it may be required in some high-risk settings. It will, however, continue to be strongly recommended in all settings. Staying home when sick will remain an important way to care for those around us by not passing on any infection, COVID-19 or any other. Testing will continue to play a part of our COVID-19 response in Alberta, but it will be changing. Starting on August 16th, we will no longer recommend that all those with mild symptoms seek testing, but rather should stay home until they are feeling better. Testing will be available for Albertans with symptoms where it is needed to make treatment decisions. This can be done through assessment centres until the end of August. After August 31st, testing for COVID-19 will be available for patients whose symptoms are severe enough to need care in hospitals or physicians' clinics. It will be conducted when needed for informing treatment decisions and as needed for outbreaks in high-risk settings. At the same time, we will also be launching a wastewater testing program to monitor the province. Testing wastewater has proven to be an accurate and valuable tool in providing early warning of a possible rise in cases. This program will work hand in hand with individual testing results to give us a good sense of where COVID-19 is in the province. More information on the testing program will be released in the coming weeks. I know that this is a lot of information to take in, so I encourage all Albertans to take the time to review the changes at alberta.ca. As I've said many times, COVID-19 is not something we have to fear, but it is something we need to respect, and we will continue to do so. These changes are a necessary step forward, one that will let us keep supporting those who become severely ill, but also help us care for those who get sick from the flu or other viruses. I want to be clear that COVID is not over. COVID-19 is still a serious virus, and it can have life-threatening consequences. And it is now primarily infecting people who don't have their vaccine, who are the minority of those who are eligible. The high protection from vaccine I spoke about earlier has been seen since our vaccine program started. 95% of all cases since January were unvaccinated or still developing immunity in the early days after a first dose. The same goes for hospitalizations, where 92% since January had no vaccine or were still within 2 weeks of their first dose. Just one patient of the 18 in ICU right now was fully vaccinated. All the rest did not have the benefit that 2 doses offer. So I want to end today with a call to arms, to borrow a phrase from other public health colleagues. Please get vaccinated. If you haven't gotten both your doses yet, this is your time. If you are between the ages of 20 and 39 and think you are not at risk from infection, it's important to know that more than 1,400 Albertans of your age have needed hospital care for COVID-19 over the last 17 months, and 200 have needed ICU care. This does not include those who go on to develop long COVID with serious implications for their life. Now is your best chance to protect yourself and to prevent passing infection to your friends and family. For those who have concerns about myocarditis, it's important to know that in a study of healthy college athletes who were infected with COVID-19, the occurrence of symptomatic heart inflammation was 100 times greater after infection than the rare events that have been observed after vaccine. Please use reliable information to make decisions and join the millions of Albertans who have gotten vaccinated. I encourage you to take this opportunity to access this life-saving intervention and make the choice to get protected. Vaccine will protect you, it will protect those around you, and it will keep our entire province safer in the months ahead. Thank you, and I'm happy to answer questions.
All right, we have a very full queue online as well as some people in the room. So we'll do one question and one follow-up. Try and keep it short, and we'll get through as many questions as possible. Janet.
You just mentioned long COVID. And you're talking later today, I understand, in a webinar about moving from a pandemic to an endemic. My understanding is that this decision about something becoming an endemic is a policy decision, not a scientific fact. Given that there's estimates that something like 1/3 of people infected with COVID can experience some of these long COVID repercussions, I'm curious, why has Alberta decided that that's the best option to allow the virus to keep circulating when the long-term consequences of the virus aren't necessarily well understood?
What we know from looking around the world is that COVID-19 will not be eliminated. We will be needing to live with this virus for years to come. And so what we need to decide as we look at the impacts of public health interventions, the choices about using a large amount of resources to focus on a single disease when there are many others that also cause illness and problems, and again, weighing the direct impacts of COVID-19 infection, is to make the determination about how we best utilize our public health resources and the human resources we have to provide the most benefit for the most people. We know that vaccines are highly effective, they are widely available, and I strongly encourage Albertans to access that protection against things like long COVID or other outcomes that can be life-altering. However, from a provincial perspective, as we look at, again, those public health markers of when it's appropriate to make shifts in our policy, we need to be thinking not just about COVID specifically, but again about all of the other issues that we need to be managing and dealing with. And we need to be ready to manage an increase in many respiratory viruses this fall. So again, this is about making sure people know they have that opportunity to be protected, and yet looking at the system as we look at that big picture of when we make that shift to managing COVID-19 as one of many infections and not the only infection that we're focused on.
Is there a follow-up, Janet?
Yeah, I mean, you mentioned the cost, the upfront cost. Is there some pressure that you're getting to reduce the amount of money that's spent on managing COVID? And if so, where is that pressure coming from?
I want to be clear about my use of the word resources. I'm talking about people. We only have so many people in our health system, in our public health system, and there are many, many challenges that we need to look at. When we use the public health trained specialists that we have and focus them almost entirely on managing COVID-19, there are other things that don't get that time and energy and attention, and we need to again look at that broad picture of all of the different threats that are out there that public health needs to pay attention to. So again, to be clear, it's really about the limited resource of human resources that I'm talking, and again, that need to be considering the big picture of all of the different public health issues that need to be managed. And as we have that opportunity to provide vaccine and the protection it offers to every Albertan who's over the age 12 and over, being able to shift some of those resources into other areas is critical because, again, COVID-19 is not the only risk that we are facing.
Go to Tom Vernon in the back.
You just mentioned 12 and over the vaccinated. Isolation requirements ending, no masking for schools this September. What should parents of children under the age of 12 be looking at when their kids go back to school if there are no masking or isolation requirements? Should we be worried about some outbreaks in that age?
It's an important and a personal question for me. As I think I've said before, I have 2 children in that age group under 12. And one of the things that's important to know for parents is that as parents, we have experience in managing risks for our children. And it may not feel like it because COVID has been new and we have had to devote extraordinary focus, attention, and unprecedented policies at controlling it. But when we look at the data and we look at how COVID-19 compares to, say, seasonal influenza for kids in that youngest age group, it's really interesting to look at our seasonal influenza data from 2019-20 and see that we actually had a higher ICU rate for seasonal influenza in kids between 4 and 9 than we've had from the entire past 17 months of COVID-19. So we know how to manage our kids' risks for influenza. We've done it every year since they've been born, except for last year. And I think we need to be thinking about COVID-19 for kids particularly in that context of how much of a risk is it to them individually, comparing it to other things that we manage for them, that we've managed for them the entire time we've been parenting, and then integrate those risks. For some kids, that risk is higher, kids who have chronic conditions. And parents will have to make decisions this fall about how to manage that. But ultimately, again, we need to be looking at how we're going to live with COVID-19, and we cannot focus on it as the single most important risk. And especially for kids, it is not directly the most important risk to their health.
Is there a follow-up, Tom?
I wanted to get you on the quarantine for close contacts tomorrow. Do you expect that may, and I know there's the high vaccination, or the vaccination rate is set at 64%, but do you expect that will increase the number of cases we see in the next few weeks? Are we going to see a bump from these changes before things start to go down?
It's difficult to predict exactly how these changes will play out and what the timing will be. Again, I expect that we will see an increase in cases. We know that as other provinces and we have lifted restrictions, we have seen a corresponding increase in cases. The important thing right now is to look not just at cases alone, but to be looking at, again, those severe outcomes as the primary reason that we had to employ the public health measures we've used over the last 17 months. We did not employ those public health measures to manage cases. We employed them to reduce the chances that our healthcare system would be overwhelmed. And before we had vaccine, the number of cases predicted the number of hospitalizations. And that is different now, again, because of the vaccination rate we have. I do want to reiterate, though, that those who don't have the protection of a vaccine now is the time to access that protection. It is widely available across the province through AHS, through pharmacies and physicians' offices, and now is the perfect time to choose protection.
All right, we'll go to the phone now and come back to the room. Operator, could you put through the first caller, please?
Thank you. Jeff Slack, 660 News.
Hi, Dr. Hinshaw. Thanks for taking my question. I just want to get your thoughts on Pfizer. They are now recommending a third dose to help boost protection against the Delta variant, especially for those who got the mixed cocktail. So I'm just wondering if the province is looking into recommending that people do get this third shot.
We have been monitoring the data on booster doses, working with the National Advisory Committee on Immunization as they monitor that evidence as well. What we understand from data that's been released by Pfizer is that at the 6-month point, the efficacy goes from 95% to 91%, so a little bit of a shift, but still very high protection at that 6-month point. We know from our own Alberta data, looking across all the vaccines that we use, that having 2 doses of vaccine, and that takes into account not just the schedules with the same vaccine, but also mixed schedules, has an 85% protection against infection with the Delta variant. And that, again, is still a very high level of protection. I want to emphasize that second dose is critically important when it comes to the Delta variant. We will continue to monitor the evidence to determine if that third booster is needed and for which groups, if any. But for right now, again, we see evidence that 2 doses are highly effective against Delta, and we need people to take that second dose. So if people have a first dose and they're thinking they don't need the second, I want to make clear that they do. And also to encourage those who haven't yet started their series to come forward and access protection.
Jeff, is there a follow-up question?
Yes. Considering Alberta's lagging behind on the national average when it comes to vaccines, and there's a possibility that people will need to either get another dose or we might have to start doing yearly things, aren't you worried that hesitancy will grow in people if they have to keep showing up to get vaccinated?
I want to be clear that at this point in time, we see that 2 doses of vaccine are highly effective. There is, of course, a lot of speculation and a lot of people who are contemplating the possibility of boosters or annual doses. But at this point in time, again, that's all musings about what might be happening in the future. We know that there is evidence that having 2 doses further apart than 4 weeks actually does increase overall protection and can actually enhance protection against even some variant cases. So the choice that was made in Canada to extend that interval between first and second doses, I think will be an important contribution to our overall population protection. And we will continue to monitor all of the evidence, but I want to be clear that when Albertans are making that decision about vaccine, that they're thinking about the current state, the fact that we still have COVID, and they're making choices that are the best for them and their family. And what will happen in the future, again, difficult to speculate, but we will continue to monitor and make the best recommendations to Albertans with available evidence.
Operator, could you put through the next caller, please?
James Keller, Globe and Mail.
Hi, Dr. Hinshaw. I wanted to ask about areas of the province that still have very low vaccination rates, such as the high-level area. What do we know about what is happening there? What is motivating people not to get vaccinated? What's explaining that?
We know that across the province there's a variety of factors that are influencing people's vaccination status. Certainly some people are concerned, have questions about the vaccine, may feel that they haven't received answers that satisfy them yet. We are working with primary care providers. Earlier it was mentioned we're doing a town hall tonight with physicians and pharmacists, and wanting to make sure that as people are looking for information, they have multiple places to go to get that accurate, reliable information, not just on our government website, but also from local providers with whom they have a trusting relationship. So one of those reasons, again, is people who still have questions and want more information. Another reason could be in some places, again, at summer holidays, we know that sometimes people are traveling or away, and so people may be intending to get vaccinated but just haven't quite gotten around to it yet. And again, we're trying to make sure that the vaccine is very convenient for them. and make sure that they have access to it at that point in time when they want to receive it. So again, there's really a mix of multiple factors. The final thing I'd mention, we know that our immunization rates in those under 40 are the lowest of all the different age groups. And so there could be a feeling of some in that age group that they feel that they're personally not at risk of COVID-19 causing significant outcomes for them, which is part of the reason why I provided the information earlier to ensure that people know, even in that younger age group, there are individuals who go on to require hospital care, ICU care, and can have serious and long-lasting implications from COVID-19 infection. So again, those are kind of the three main reasons that we're seeing, and we're making sure that we're doing everything we can to provide accurate information, to provide access, and to continue to learn through local partners what other means might be effective.
James, is there a follow-up question?
Definitely. And how likely is it then that we will have areas of the province, and thinking of the high-level area in particular, that never have a high level of vaccination immunity? And then what problems would that pose if you've got an area where, you know, the overwhelming majority of the population just does not have vaccination protection?
It's possible. I think it's highly likely that we will have different coverage in different areas of the province, again, as people kind of have different motivations. What we know from having watched our data over the last year and a half is that there have at times been highly localized outbreaks in specific areas. And when we have had those kinds of outbreaks just in one particular location, the system is able to manage the severe outcomes that come out of it. And so what we, again, want to encourage people, number one, is to access the protection vaccine offers. And for those that don't choose that, want to make sure that, again, if we're seeing a surge of cases with severe outcomes in a particular location, that we have the ability to support people who live in that location with potential additional outbreak measures to prevent spread. And then thirdly, again, that if we do see that surge in different parts of the province, that we are able to support people who do need access to acute care at that time. But I again want to reiterate that vaccine is the most important thing that we have in our toolbox to be able to prevent illness. And then we will, again, be able to support in those specific localized areas if problems arise.
All right, we've got time for 3 more callers. We'll take 2 more from the phone and end in the room. Operator, could you put through the next caller, please?
Jason Herring, Post Media.
Hi, Dr. Hinshaw. The first question is just about the data update on Friday. On that day, Alberta Health retroactively removed 75 COVID-19 cases from its database. Most of the cases were from December 2020, and officials said these cases were discovered to be duplicates. You reported there were 98 new cases on Friday, but this was only the net change in cases. Detailed data showed 173 new cases were actually identified. Just wondering what you would say to Albertans concerned that this data release was misleading or non-transparent.
I can understand the concerns that people would have about that particular day. Unfortunately, when we have automated processes that run, some of those run in the background to do the data cleanup. Other automated processes are the ones that kind of factor in the total new and the net new cases every day. So unfortunately, on that particular day, there was a coincidence of the automated data cleanup process running at the same time as we had a higher number of cases. So it was certainly not intentional. It was part of our routine data processes. And I do apologize to Albertans who felt that that was misleading. It was not the intention to do so. And we do make sure that the complete information is available on our website. We have reported net new cases consistently throughout the pandemic. That's been our approach, again, given that earlier when we were reporting new cases and the totals weren't matching, we were receiving concerns that our data were inaccurate. So we moved to net new cases, and then, of course, sometimes that causes some challenges as well, but it certainly was not intentional.
Jason, is there a follow-up question?
Yeah, thank you. I just wanted to ask about Stampede. I know that there was a release out yesterday from Stampede with some AHS comment that there were only 71 cases that were picked up at the festival. Just wondering how this can be said, you know, with this definitive tone when there's not even 2 weeks that have passed since that event.
So the information that was shared, and I do want to provide an update in terms of what we have as of yesterday's data, which is to say when we have an event, and certainly an event of interest like the Stampede, the data is not static. Of course, we continue to monitor, and so the data that was provided with 71 cases was current as of that date. But we do continue to monitor new cases as they come in. There is continuing to be case investigation. And as of yesterday, there was an increase. So at this point in time, there have been 84 cases that have been identified as having most likely been acquired at the Stampede out of more than 500,000 attendees. So again, important to remember the denominator as well as the number of cases. And just want to take you through a bit of that process, because when we get a case, part of the case investigation is finding out where that individual was when they were infectious, when they could have passed it to others, and where they were in the 14 days before they got sick, so where they might have acquired it. So when cases are identified that were at the Stampede in either of those periods, they're flagged for some additional investigation. And at that point in time, our investigators determine where is the most likely place that they acquired it, because we know that some people who attended the Stampede also might have attended a house party, or they might have been to another location, they might have acquired it from someone at home. So just because they were at the Stampede in that 14-day period doesn't mean they acquired it there. So that 84 is the number that after all of that assessment, it's been deemed as the most likely location of acquisition. And again, just thinking through the volume of people who were there and the protective measures in place, we did know there would be some transmission events. We will continue to monitor, and so that number will likely change over the coming days. However, we're sitting certainly a few weeks past the onset of Stampede, so anticipate the number of new cases that we add will decrease over time. And again, want to emphasize that what matters right now, cases are less important, and hospitalizations and severe outcomes are really the critical indicator that we are moving towards watching.
Operator, could you put through the next caller, please?
Don Braid, Calgary Herald.
Dr. Hinshaw, I wonder what your tolerance number for level for cases is. As cases rise, now we're up to 194. We have more from the Stampede. This could go into the hundreds. This could get quite high. And, some people, I'm sure you know very well, some people who get sick and don't go to hospital are indeed very sick. I have personal experience of that in our own family, from somebody who caught the disease twice. I mean, this is still a very serious illness, and a lot of people who don't ever get to hospital get very, very sick and have their whole lives affected by it, or at least some time into the future. So my question is, what is your tolerance for increasing case numbers, or is your only metric hospitalizations and deaths?
So first of all, I think you're absolutely right, and I express my sympathies for the member of your family who had to experience that. COVID-19 remains a serious disease. I want to be clear that that is the case, and to be clear that vaccine is the #1 best thing that people can access to protect themselves and those around them. So that remains true. What we're talking about today isn't a shift because COVID-19 at an individual level in someone who's not vaccinated is less of a problem. What the shift is motivated by, again, is looking across the whole system, looking at the fact that we have multiple other challenges that we need to turn our attention to, and that focusing on COVID-19 to the exclusion of other things is a risk in and of itself. So in terms of the case numbers, again, a case number in and of itself, while each individual potentially is at risk, it's those who are unvaccinated who are at the highest risk, and those who have risk factors for severe outcomes. So we're not necessarily monitoring individual case counts, as I said before. There's not really a number of cases past which we would be re-implementing measures. However, if we see a new variant that's spreading that vaccines don't protect against, if we're seeing a surge, particularly in a localized area, a surge in cases that's leading to severe outcomes, then we absolutely will be looking at interventions in those locations. And I want to reiterate that there are some protective measures that will remain in high-risk locations. So we need to make sure that as we're thinking forward into the fall, COVID-19 is something we need to continue to pay attention to, but we are shifting. So there is not a certain level of cases. We're again shifting more to looking at those severe outcomes while recognizing that people can have long COVID without even ending up in hospital. But going back to that previous point that vaccines are the #1 most important thing, and to follow up on your point of someone who was infected twice, just to reiterate that even having had COVID-19 infection is still very important to get vaccinated, because vaccine does provide additional protection, particularly protection against variants. So infection alone is not a guarantee that someone is protected.
Don, is there a follow-up question?
Yes, masks. You haven't said much about masks. So there are going to be people who still want to wear masks and still will wear masks, particularly people who are immune compromised, who may be eligible for booster shots if they ever come. But there are older folks and people who have other illnesses who are still going to be nervous out there. And I'm just wondering what your attitude is toward people who choose voluntarily to wear masks in whatever setting, whether they're in a restaurant or wherever. And I presume you'd encourage others to tolerate that.
Absolutely. Masks are a completely reasonable intervention. And as individuals assess their own risk, we will, as I mentioned earlier, have some wastewater monitoring data. So being able to see the shift in geographical levels of COVID-19. So being able to inform people about the potential exposure risk in their own neighborhoods and areas to inform those decisions about protective measures they may wish to take. And masks should be absolutely supported. Individuals who choose to wear them should be able to wear them without being criticized or asked to remove them. Because again, we're entering into a respiratory virus season where it's great if people have 2 doses of COVID-19, that's fantastic. But we will be seeing other respiratory viruses come up again. And so wearing a mask may also be a very reasonable measure to prevent infection with some of these other viruses that we will see rebounding this fall.
All right, we'll turn to our final in the room.
Hi, it's Jeremy Thompson with the CTV News. Dr. Hinshaw, as you keep saying, the vaccinations are the most important part of the fight against COVID right now. So, and there was a huge push prior to Canada Day to get people vaccinated. So I'm wondering, it seems like that has maybe slowed a little bit, and maybe that's just subjective, but what more is the government continuing to do to encourage people to get vaccinated, and what, if anything, is the government able to do for those who aren't vaccinated?
So the responsibility, the opportunity to support vaccination is a shared one, and so there's certain things that government can do, but there's other things that other partners in the process can do, which may actually be more effective than government in some local areas. So we are continuing to hold town hall meetings with multiple different stakeholder groups to talk to people in municipalities, tonight with pharmacists and physicians, planning some with other healthcare professionals, to be able to answer questions, to encourage those at a local level to think about how they can support vaccine uptake efforts. Because at this point in time, there's been a lot of formal government messaging, there have been social media campaigns, there's been quite a bit of work on multiple fronts. But what we're hearing is that many people want to be able to ask their questions of someone that they know locally, their own doctor, their own pharmacist. And so we need to make sure that we are equipping people. Again, there's many skilled healthcare providers out there who are doing an excellent job of this already, but making sure that there are supports in place to enable that, and also to be thinking about other partners. So I know, people have told me stories about getting a vaccine because their employer asked, not mandated it, but just asked, oh, have you been vaccinated? Again, you have to be careful with health information. And so there's guidelines that people can reference on talking about vaccine in the workplace. We have employer toolkits available on our website, but creating supportive environments for those who are thinking about vaccine, making sure that people who are thinking about it are treated in a respectful way, whatever their decision is. And that's one of the things I think is really important, is that we don't start to treat people disrespectfully if they choose something different than us, because that's unlikely to encourage them to make any kind of a different choice. So those are the kinds of things that I think, again, not just government, but all of us can do, is be respectful, make sure people have access to the right information. And again, we're trying to work with local partners as likely the most effective change agents going forward.
Follow up, Jeremy?
Yeah, just a quick one here. I'm wondering if you're aware of any other jurisdiction, I guess anywhere, that is sort of moving to eliminate the quarantine requirements for a positive case, and if not, does that raise any flags for you as far as maybe it's not the best move for Alberta to lead the way on that?
We have been talking with colleagues, of course, across the country, and watching what jurisdictions around the world have been doing. One of the things that's important to note in terms of context is there are very few places around the world that have the kinds of vaccine coverage that we have. In speaking to other colleagues who are contemplating their forward planning, everybody is aware that their current approach is not sustainable. The question is, what time point do we make a shift into living with COVID? I think everyone's aware that we're not going to eliminate COVID. And so there are risks and benefits of different time points of making that shift. And there's also risks of maintaining status quo and having a huge investment of human resources. Again, I'm talking about the people that are really focused on COVID, that takes away from some of those other things that we need to contemplate. So I think that there's not necessarily an analogous jurisdiction that's made exactly the same decision, but there's probably not another jurisdiction that's in exactly the same place. Some jurisdictions in the U.S. have moved quite aggressively away from any kind of containment measures. And so again, we're watching those locations. We are maintaining, again, several containment measures in high-risk locations. Surveillance such as wastewater monitoring, we will continue to make data available. So again, COVID's not over. We just need to integrate how we manage it into how we manage other illnesses as well.
Thank you all for joining us. I know we couldn't get to everyone in the room or on the queue, but we'll happily follow up with me offline and I'll get you the answers you need. Have a safe evening.